You may have subtle inflammatory lung disease, not AAV or asthma, that you're not appreciating. But I do believe that it is, in many patients, quieting the larynx, which is inflamed, which is triggering off these cough receptors. What I do is the following. Okay, what do you go back to your practice and do when I've identified patients with RCC, UCC? I use chlorpheniramine 12 milligrams at night, increase it up to twice a day as needed. If that doesn't work, I will add or substitute gabapentin, starting at 100 or 300 milligrams at night, depending on what you think their tolerance is. I'll increase every 5 to 10 days as needed and tolerate it up to 1,800 milligrams a day. If not, I will try amitriptyline, 10 milligrams up to 30 milligrams a day, sometimes combining low-dose gabapentin and amitriptyline, which has been used in the chronic pain. And if you notice, these are all used in itching pain. Okay, we're all treating the same thing. And then the new one lately, particularly if they have a little anxiety, is duloxetine, can be very effective. And again, everybody's their own snowflake. They're gonna, you just try to see what you throw the spaghetti and see if it hits the wall. And finally, Pusionex, which is again the hydrocodone chlorpheniramine, but it's Schedule 2. You got to go to E-Force, you got to get consent, and do all that stuff. Okay, there's also this behavioral component, and that's where we get into speech therapy, some relaxation techniques, hydration, GERD management. But again, we'll either use your speech therapist or I use some very, very simple laryngeal muscle relaxation techniques, making the analogy to a bad back. You got to stretch the muscles. You stretch these muscles, you don't squeeze the nerve, you won't tickle. So in the last minute and 17 seconds, I may go over by 20 seconds. I do want to talk to you about this new drug called gefapixant. There's the P2X3 receptors, which are one of these groups in these nociceptive pathways. There's basically two, it is a response to ATP, which is the ligand for irritation and lung inflammation, that will then lead to the midbrain and back. There is a heterotimer called which involves with taste. And the issue with this drug gefapixant and the similar P2X3 antagonists is that will also affect taste, okay? It does not go upstairs, so you get no other side effects. There's no addiction. There's no CNS types of things. And these are the studies that I was involved with, which very quickly will show you that we started at 200 milligrams, but we found that the efficacy started to just go away around 30 milligrams. But you had these taste issues that also were there, but went away around 30 milligrams. Therefore, they came into this phase 2 and then phase 3 studies. And this is the phase 3 study showing 2,000 patients with RCC and UCC for this drug called gefapixant over 12 and 24 weeks. And it found that the placebo rate was 55%. And that's on another day we can talk about why. But it showed that they had around an 18% improvement. 2/3 of the patients got better on gefapixant, but this was statistically significant. Yet there's a lot of taste issues, including some discontinuation. This drug is now sitting in front of the FDA. It's already been approved in Japan and Switzerland. It was sent back because of methodology issues, nothing to do with the drug. And we're looking for it to be relooked at again sometime this year, and hopefully this will be coming to market as the first true drug for chronic cough. And this last slide just tells us that there's 2 others in the pipeline. And I want to finish off here, being breaking the rule of going over, is that chronic cough lasting greater than 8 weeks may be a symptom of underlying cause, commonly upper airway, lower airway GERD, or ACE inhibitors. Chronic cough is either going to be refractory, as you look for things and couldn't find it, or didn't find anything that's upper airway chronic cough. It's a separate disease state. It's due to cough reflex hyperreactivity or cough hypersensitivity. I've given you some of the drugs that you can use in your clinic to treat this condition. You can identify with these clinical characteristics, and a new novel cough drug is coming up right now. Thank you for your attention. And now